The dog came through the emergency doors like a grenade had gone off behind him. 110 pounds of Belgian Malinois, retired combat unit, and right now completely uncontrollable, slamming into the reception desk hard enough to send a monitor crashing to the floor, snapping at anything that moved, foam at the corners of his mouth, eyes rolling white. Staff screamed. Someone hit the panic button. Two techs sprinted for the back hallway and didn't look behind them. And then the dog stopped. Not slowed down. Stopped. Like someone had cut the power. He stood in the middle of the chaos, chest heaving, blood smeared across his left flank from where he'd torn through the doorframe. And he was staring at the one person in the room who hadn't moved. She was standing against the far wall with a needle cap between her teeth and a clipboard tucked under her arm, watching him the way you'd watch a thunderstorm roll in. Not scared, not performing calm, just still. The dog took one step toward her, then another, and she crouched down, said something nobody else could hear, and put her hand out flat. He walked straight to her and dropped his head into her palm. The room was completely silent. If you're new here, hit that subscribe button and follow this story all the way to the end. Like this video if it's got you hooked already, and drop a comment with the city you're watching from. I want to see how far this story travels. The morning had started the way most Tuesdays started at Harlow Peak Veterinary Hospital. Understaffed, overbooked, and running 40 minutes behind by 7:15. Madison Reyes had gotten there at 6:40, same as always, because if she didn't set up Bay 3 before the first surgical prep came in, nobody else would remember to. She was 29 years old, 5'4", and had the kind of face that people described as forgettable when they were being polite and plain when they weren't. Her blonde hair was pulled back in a clip that had broken 2 weeks ago, and she kept meaning to replace. Her scrubs had a bleach stain on the left sleeve from an incident with a bottle of chlorhexidine that she'd never fully been able to explain. She was not, by any measure, the kind of person people noticed when they walked into a room. That was fine. She'd spent years making sure of it. Harlow Peak was a mid-sized veterinary hospital in the city of Varnfield, Oregon. Not a small-town clinic, not a big urban trauma center, but the kind of in-between place that handled everything from routine wellness checks to emergency surgery, always slightly overwhelmed, always slightly underfunded. It sat on the corner of Mercer and 14th, next to a dry cleaner and a parking garage that charged $8 an hour. And on a busy day, the waiting room smelled like wet dog and industrial cleaner, and the particular desperation of people who couldn't afford to lose their animals. Madison had been working there for 2 years. Before that, she'd been somewhere else entirely. But she didn't talk about that, and nobody had thought to ask. She was refilling syringes in Bay 3 when she heard the commotion start at the front desk. It sounded at first like a dropped tray, a crash, then a series of shorter impacts, then voices rising. She set the syringe down and moved toward the hallway. Dr. Petra Holst nearly collided with her coming the other direction. Petra was the senior veterinarian on duty, mid-50s, German-born, with the kind of blunt manner that people either respected or couldn't handle. She grabbed Madison's arm with both hands. "Don't go out there," Petra said. "Military dog. Handler brought it in. It went for Callum the second they came through the door." "How bad?" "Callum's fine. The dog missed. But it's going for anyone in scrubs. We've got the whole front locked down." She looked rattled, which was unusual for Petra. "Animal control is 12 minutes out. I've called the police non-emergency line. We just need to—" The sound from the lobby changed. The barking cut off. Both of them froze. Petra looked at Madison. Madison was already moving. She pushed through the side door into the lobby and took in the scene in about 2 seconds. Reception desk half dismantled, a monitor face down on the floor, Callum from intake crouched behind the counter, pressing a hand to his forearm, even though he'd said he was fine, 2 vet techs backed against the far window. And a man standing in the center of the room with his hands out, looking at the dog in front of him like he was watching something he couldn't explain. The dog had its head in Madison's palm. She was crouching, her free hand moving slowly along the animal's neck, and she was talking, very quietly, in a register too low to make out from across the room. The dog's body language had shifted completely. Not relaxed, nothing like relaxed, but contained, directed, like a circuit that had found a ground. The man standing in the center of the room was somewhere in his mid-30s, broad-shouldered, wearing civilian clothes that fit the way civilian clothes fit on someone who'd been in uniform long enough that they still stood like they were. His jaw was set. His eyes tracked Madison with an expression that was 1 part disbelief and 2 parts something harder to name. He said, "What is she doing?" Nobody answered him. Nobody was sure. Madison looked up. "What's his name?" The man blinked. "Rook." She went back to the dog. "Rook, okay." She moved her hand to his flank and ran 2 fingers along a spot near his hip, and the dog flinched hard and then leaned into her hand anyway. "How long has he been aggressive?" she asked. The man crossed his arms. "That's not what I'm here to discuss." "I understand, but I'm asking because he just flinched when I touched his left hip, and the way he came in through those doors wasn't panic aggression. It looked like pain aggression. Those are different problems." The man looked at her for a moment. "He's retired. He's been retired for 8 months. He does this, goes off without warning, can't be controlled, even with me." A beat. "He used to be the most stable working dog I've ever seen, and nobody's figured out why it changed. 3 evaluations, all clean." His voice had an edge to it. "They cleared him physically and said it was behavioral, adjustment disorder, recommended training modification." Madison stood up slowly, keeping one hand on Rook's back. "Who ran the evaluations?" "Military contracted veterinarians, standard retirement clearance protocol." He looked at her like he was gauging something. "I'm Callan Voss. I was his handler for 4 years. Madison Reyes." She glanced down at Rook, who was pressing against her leg now like she was ballast. "I want to run some imaging." Callan's expression didn't change, but something behind it did. The last 3 vets who looked at him said imaging wasn't necessary. Then the last 3 vets weren't watching him walk. Petra had appeared in the doorway behind Madison. She said nothing. Callan looked at Madison for a long moment. Then he looked at Rook, who was so still against her leg that it was almost hard to believe he'd been destroying the lobby 2 minutes ago. "I need someone more qualified than a nurse," Callan said. It wasn't cruel exactly. It was the kind of dismissal people delivered when they were scared and didn't know where to put it. "Is there a veterinarian I can speak with?" "I'm right here," Petra said from the doorway. "Then I'd like the doctor to handle this." Madison didn't react. She just said, "Let's find out what's actually wrong with him first. Then you can decide who handles what." She moved toward the hallway, and Rook followed her. The imaging took 45 minutes. Rook cooperated with Madison in a way that made the techs exchange glances when they thought she couldn't see. Getting a distressed animal to hold still for radiographs was a 2 or 3 person job on a good day. With Madison, it was just her, talking low, keeping contact, repositioning him with her hands while the plates moved into place. Callan waited in the hallway outside. He didn't sit. He stood with his back to the wall and his arms crossed and didn't say anything to anyone who passed. Petra pulled Madison aside before they looked at the results. "You want to tell me what's going on?" she said. "I want to see the films first." "Madison," Petra's voice dropped. "The way you handled that animal. That's not something you learn in veterinary nurse training?" "I've worked with a lot of dogs." Petra studied her. "Where?" "Before here." Madison picked up the tablet. "Can we look at the films?" They looked at the films. The silence that followed was the kind that made the air feel different. Petra set the tablet down on the counter, picked it back up, and set it down again. "That's a hip fracture." "Yes." "A severe one. The bone structure here. This isn't a recent injury." She traced the screen with one finger, not touching it. "This has been there for at minimum a year," Madison said. "Maybe longer. Look at the remodeling pattern. His body has been compensating for this for a long time." Petra looked at her. "He passed 3 military evaluations." "Yes." "How does a dog with a fracture like this pass 3 evaluations?" Madison didn't answer right away. She was looking at the films, and her face was doing something quiet and controlled that Petra hadn't seen before. "That," Madison said finally, "is the right question." "What?" They brought Callan in to look at the results. He stood in front of the imaging screen for a long time without speaking. His hands were at his sides. Rook was lying on the padded table behind him with his head up, watching. When Callan finally spoke, his voice was flat in the specific way voices get when the emotion is too large to fit into any natural register. How long has he been in pain? It wasn't a question. Based on what I'm seeing here, Petra said carefully, the fracture itself and the secondary degeneration around the joint, I'd estimate this has been causing him significant pain for 12 to 18 months, possibly longer. He was evaluated 8 months ago. Callan's jaw moved. Before I could take custody, they said he was physically healthy. They said the aggression was behavioral. Whoever ran that evaluation either missed this entirely, which would be a substantial professional failure, or Petra stopped. Or they didn't look, Callan said. The room was quiet. He trusted them. Callan said it quietly, almost to himself. He did everything they asked him to do for 4 years. Deployments, raids, 3 rotations overseas. He was steady every time, no matter what was happening. And they sent him home, and he was in agony, and nobody... He stopped, pressed his mouth shut. Nobody caught it. Madison was looking at the imaging screen. Not at Callan, not at Rook, at the films. And there was something in her face, not pity, not sympathy exactly, something older than that. We can help him, she said. The fracture is serious, but it's treatable. He'll need surgery and he'll need a real rehabilitation protocol, but he's not broken. Callan looked at her. What kind of rehabilitation protocol? The kind that takes time and doesn't cut corners. He held her gaze for a moment. You've done this before. I've done a version of it. What version? She picked up the tablet. The one where we stabilize him first, figure out what surgery is going to look like, and go from there. That's the version I'm focused on right now. Callan didn't push it, but he didn't stop watching her either. Madison was in the medication room pulling up Rook's intake records on the terminal when she heard the shift in the noise level out front. Not an emergency. Something else. Voices that had gone formal and careful, the way voices did when someone official walked in. She kept her eyes on the screen. Callum appeared in the doorway 30 seconds later. He was holding his forearm, the one he'd been pressing earlier, which had turned out to be a shallow graze that needed 3 steri strips and apparently hadn't stopped him from being the one to deliver news. Madison. He was looking at her strangely. I'm pulling his prior records. What is it? There are 2 people at the front desk. They asked for you. She turned. Specifically you, he said. Not Dr. Holst, not whoever's on charge. They asked for Madison Reyes, and one of them showed a badge. And Petra's been out there for 5 minutes, and she looks like she's seen a ghost. Madison set the tablet down. What kind of badge? Federal. She was quiet for a moment. Okay, she said. Okay? Madison, federal investigators are at the front desk asking for you by name, and Are you going to tell me what's going on? I'm going to go talk to them. She walked past him into the hallway. Basim. There were 2 of them, a man and a woman, both in dark civilian clothing, both carrying the specific posture of federal agents who were trying to look like they weren't federal agents, which was its own kind of signature. The woman was holding a credentials case. The man was scanning the room in small, practiced increments. Every staff member who wasn't occupied was watching. Petra was standing off to the side of the reception desk with her arms crossed over her chest, and when she saw Madison come through the door, the expression on her face shifted from controlled shock to something more complicated. Callan Voss was still in the hallway near the imaging suite. He'd heard the change in the lobby and drifted forward. Now he was standing at the edge of the room with his arms at his sides, watching. The female agent said, Madison Reyes. Yes. She opened the credentials case. Special Agent Nora Finch, Department of Defense Inspector General's Office. This is Agent Damon Price. She let Madison look at the badge long enough to register it. We'd like to speak with you privately if that's possible. The room was very quiet for a place that was normally never quiet. We can use the consultation room, Madison said. Price glanced toward the hallway, toward the imaging suite. We understand you have a patient, a military working dog, that came in this morning. Yes. We'd like to discuss that, along with some prior matters. He looked at her steadily. Prior to your current position. Petra made a sound that wasn't quite a word. Callum had appeared behind her, and 2 of the vet techs had materialized in the doorway from the treatment wing, and all of them were staring at Madison Reyes. The nurse nobody really noticed, the one who always showed up early and left late and didn't talk about herself, with the specific expression of people who were realizing they'd been looking at something a long time without seeing it. Madison said, "This way." She led them to this consultation room and closed the door. But the room was 6 feet by 8 feet and smelled like the industrial cleaner they used on the exam tables. It had 2 chairs and a rolling stool and a wall-mounted screen they used for showing clients imaging results. Madison stood near the screen rather than sitting. Finch sat down. Price stayed standing. "You already know why we're here," Finch said. It wasn't a question. "Tell me what you know," Madison said. "Then I'll tell you if you're right." Price almost smiled. Almost. "The dog that came in this morning, Rook, handler Callan Voss, retired, former Special Operations K-9 Unit, 7th Group. You ran imaging and found a significant hip fracture." "A severe hip fracture with over a year of secondary degeneration," Madison said. "He passed 3 mandatory retirement evaluations. The most recent was 8 months ago." "We know." Finch pulled a folder from the bag she was carrying and set it on the exam table. "We've been investigating military K-9 retirement clearance procedures for the last 7 months. Rook is the 14th case we've identified where an animal with a documented medical issue was cleared as physically healthy." Madison said nothing. "We were already tracking this facility," Price said. "Not this veterinary hospital. The contracting facility that ran the evaluations. 2 days ago, we got an alert that Rook had been brought to a civilian vet in Varnfield. When we pulled the intake information, your name came up." He paused. "We recognized it." Finch said, "You filed a complaint with the Military Working Dog Oversight Board 4 years ago. You were a trauma nurse attached to a K-9 rehabilitation unit at the time, overseas, Corvath Province, 2nd deployment. You reported discrepancies in medical documentation for dogs being cleared for retirement." "And the complaint was dismissed," Madison said. "Yes." "And I was reassigned within 3 weeks." "Yes." "And 18 months later, I was out of the military entirely, with a personnel record that made it very difficult to get any job that required a security clearance." She said it without inflection. Not bitterness, not anger, just fact. "And 3 people I filed complaints about are still working in contracted positions with access to military veterinary records." The agents exchanged a look. "You kept documentation," Finch said. "I kept everything." Price leaned forward slightly. "Ms. Reyes, the complaint you filed 4 years ago, the evidence you described in that complaint, the records and reports you said you'd preserved, we need to know if that documentation still exists." "It exists." "And you'd be willing to provide it as part of an active federal investigation?" She looked at them steadily. "I've been waiting 4 years to provide it." A beat. "The question I have for you is whether this time someone at the federal level is actually going to do something with it." Finch held her gaze. "That's why we're here." The consultation room door opened 12 minutes later. The lobby had cleared out, clients had been rerouted, the reception desk had been quietly managed, the staff who'd been openly staring had been dispersed by Petra's efficient and completely no-nonsense intervention. But Callan Voss was still there. He was sitting in one of the lobby chairs with his forearms on his knees, and when Madison came out of the consultation room, he looked up. The 2 agents followed her out. Neither of them looked at Callan the way people looked at strangers. They looked at him the way investigators looked at witnesses they'd already identified. Callan said, "What's going on?" Madison stopped in front of him. She was quiet for a moment, and he could see her choosing what to say, not hiding something, but organizing it. There was a difference. "Rook's injury should have been found in his retirement evaluation," she said. "It wasn't. We're working on understanding why." "That's not an answer." "It's the answer I can give you right now." She held his gaze. "What I can tell you is that Rook is going to get the treatment he needs. We're scheduling a surgical consult for tomorrow morning. I'll be there for all of it." Callan looked past her at the 2 agents, then back at her. "Who are you?" "I'm the person who's going to help Rook," she said. "That's what matters today." He looked at her for a long moment. Something was working through his expression. The disbelief from earlier was still there, but it had changed shape. Less dismissal. More recalibration. "The nurse," he said slowly, like he was saying it out loud to see how it fit. The nurse who nobody was paying attention to. Madison didn't respond to that. I want to know, he said. When this is over, I want to know who you actually are. Let's get through today first. She turned back toward the treatment wing. Rook, who had been lying on the padded floor of Bay 2 with the door open, lifted his head when she came into the hallway and got to his feet, careful and slow, on the hip that had been carrying a fracture in silence for over a year. She crouched down and put her hand on his neck, and he leaned into it. I know, she said quietly. You did good today. You're going to be okay. Behind her, through the consultation room wall, she could hear Finch on a phone call. The words were muffled, but one phrase came through clearly. We've got the witness. We're moving forward. Madison kept her hand on Rook and didn't move. 4 years. 4 years of being dismissed, reassigned, quietly boxed out of every room where decisions were made. 4 years of a file sitting in encrypted storage on a drive she'd never stopped updating, because she knew, had always known, that the moment would come where someone with authority would finally look at what she'd seen. Today, Rook had walked through a door in agony and pressed his head into her hand, and 2 federal agents had said her name out loud in a room full of people who'd never thought to ask it. The fracture in the imaging films was real. The records she'd kept were real. The dogs who'd been cleared on paper while their bodies were failing them, they were real. Everything else was about to become very, very loud. She heard Petra's footsteps in the hallway before she saw her. The doctor stopped in the doorway of Bay 2 and looked at Madison and Rook for a long moment. You want to tell me, Petra said, how a veterinary nurse knows more about military working dog rehabilitation protocol than any military veterinarian I've ever met. Not tonight. Tomorrow, then. Madison looked up. After the surgical consult, Petra studied her. You knew something was wrong with that dog the moment he came through those doors. I knew something was wrong the moment he stopped. Pain aggression presents differently than fear aggression. He wasn't afraid of anything in this room. He was hurting, and nobody had ever listened. Petra was quiet for a moment, then, the agents, how long have you been in contact with them? I haven't been. They found me. Madison stood up. They found Rook, and then they found me. And the complaint you filed 4 years ago. You heard that. The walls are thin, Petra crossed her arms. I've worked with you for 2 years. You show up before anyone else. You do the work nobody asks you to do. You never talk about where you came from. A pause. I should have asked. I didn't want to be asked. That's not the same as it being right that nobody did. Petra looked at her steadily. Are you in danger? Madison considered the question seriously, the way she considered all questions. I don't know yet. I think we'll find out what this investigation touches before we know how much pressure comes back. Is there anything I can do? Keep the schedule normal. Don't tell anyone what the agent said. And make sure Rook's surgical consult is confirmed for tomorrow morning. She bent down again and ran a hand along the dog's back. He's been waiting long enough. Petra nodded once. She turned to go, then stopped. Madison. Yeah. I'm glad you were the one standing against that wall when he came through the door. Madison didn't say anything to that. But after Petra left, she sat down on the floor next to Rook in the quiet of Bay 2, and for just a moment she let herself feel the full weight of the day. Not the victory of it, not the fear of what was coming, but the fact of it, that Rook was here, that he'd been found, that somewhere in the sequence of an ordinary Tuesday, a door had cracked open that had been shut for 4 years. On her phone, 3 time zones away, a notification appeared from an encrypted drive she hadn't opened in 6 months. Someone had tried to access it. Not her. She stared at the notification for a long moment, then locked the screen and slipped the phone into her pocket. Whatever was coming, it wasn't going to wait. The drive was an encrypted thumb drive the size of a fingernail, matte black, no markings, stored in a waterproof case inside a locked box, inside a locked drawer in the second bedroom of her apartment that she used as an office and never let anyone into. She'd checked it twice a year, every year, for 4 years. Not to look at the files, she knew what was in them. She checked it to make sure it was still there, still intact, still hers. Someone had tried to access it remotely. Not the physical drive, the cloud mirror she kept as a backup, partitioned and encrypted behind a two-factor system she'd set up herself using protocols she'd learned during her second deployment from a signals officer who'd had very firm opinions about data security. The mirror existed exactly for this scenario. If the physical drive was ever compromised, the backup would survive. And if someone tried to reach the backup, she'd know. She knew. She drove home at 9:15 with Rook's surgical consult confirmed for 8 the next morning, and her hands steady on the wheel, but her mind working fast and cold, the way it worked when the situation shifted from manageable to dangerous, and there wasn't any room for the wrong kind of feeling. Her apartment was on the 4th floor of a building on Caswell Street. Functional, secure, nothing that would catch anyone's eye. She'd chosen it the same way she chose most things, for what it didn't advertise. She took the stairs instead of the elevator, which she did sometimes out of habit, and tonight specifically because the stairwell had a landing window that let her see the parking lot before she walked into it. The lot looked normal. Her car was the only new arrival. She unlocked the apartment, did a quick walkthrough, not paranoid, just thorough, and there was a difference. And then sat down at her desk with the thumb drive in her hand and pulled up the access log on her laptop. The attempt had come at 6:42 p.m., while she'd been in consultation with Finch and Price. While her attention had been entirely on the room she was in. The attempt had failed. Her system had logged the source IP before blocking it, and she spent 20 minutes tracing the routing. It wasn't clean. Whoever had done it knew how to obscure an origin. But it wasn't clean enough. The traffic had bounced through 3 nodes, and the second node had a signature she'd seen before. She sat back and looked at the ceiling. They'd moved fast. Faster than she'd expected, which meant someone had been watching for exactly this. For the moment, Rook surfaced somewhere. For the moment, her name got attached to something that could reopen the old file. The attempt on the drive was a probe, not an extraction. They wanted to know what she had, whether it was still there. It was still there. She called Finch's number at 9:50. "Someone tried to access my backup storage," she said when the agent picked up. "Tonight, 6:42. While I was talking to you." A pause on the other end. Then, "You're sure?" "I have the log." "Send it to the secure address I gave you. Don't use your regular email." Another pause. Shorter. "Are you somewhere safe?" "I'm home." "Stay there tonight. We'll have someone do a pass on your street in the next hour. Don't open the backup to anyone, including us, until we've set up a proper chain of custody." "I know how chain of custody works." "I know you do." Finch's voice had changed slightly. Still professional, but with something underneath it that was almost, not quite, relief. "Ms. Reyes, the fact that someone moved this quickly tells us the network is still active. We're dealing with people who have resources and who've been operating long enough to have response protocols." "I know that too." Madison looked at the drive in her hand. "What I want to know is whether you have enough without my files to move forward, or whether this whole case hangs on what I have." Silence. "That's what I thought," she said. "Then we need to be careful about how we do this. Because if something happens to me or to this drive, you lose 4 years of documented evidence and they win. Nothing is going to happen to you. Don't make promises that depend on variables you can't control." She kept her voice even. "Tell me what you need from me tomorrow, and I'll be there. But we do this right." She ended the call and sat in the quiet of her apartment, and for the first time since the morning, let herself think about Rook. Not about the case, not about the investigation, not about the drive or the access log or the IP routing through 3 anonymous nodes. About a dog who had walked through an emergency door in agony and immediately, on some instinct that ignored everything his pain had taught him to distrust, had come to her. She didn't know what that meant. She wasn't sure it meant anything. But it sat in her chest in a specific way, heavy and warm and complicated, and she let it sit there for a few minutes before she put it away and went to make coffee she didn't actually need. The surgical consult the next morning was handled by Dr. Arvid Holm, the orthopedic specialist Petra had called in from his private practice across town. He was 61 years old, retired from university teaching, and operated now on a referral basis because, as he'd once told Petra, he'd earned the right to only work on cases that interested him. Rook's case interested him. He looked at the imaging for 3 full minutes without speaking, which Madison had learned was a good sign. The bad specialist talked immediately. The good ones thought. The fracture pattern, he said finally, suggests significant force, possibly a fall, possibly a strike during active duty. The body has been compensating through the surrounding musculature, which is why range of motion wasn't flagged. He learned to move in a way that offloaded the joint. He looked at Rook, who was standing on the exam table with Madison's hand on his back. He's been doing that for a long time, probably longer than a year. Callan was in the room. He'd shown up at 7:45 and asked to be present, and Petra had said yes before Madison could weigh in either direction. He was standing near the door, and he hadn't said much, but Madison could see him doing the same calculation she was, taking the time frame the specialist was describing and placing it against the timeline of Rook's service. "How does a dog with this injury function at working level?" Callan asked. "They don't," Holmes said plainly. "Not properly. Working dogs are conditioned to an extraordinarily high pain tolerance. It's part of what makes them effective. A human athlete with this injury would have stopped immediately. A military working dog would keep going for months before the behavioral signals became undeniable." He looked at Callan. "How long was he showing aggression before he was retired?" Callan was quiet for a moment. "It started maybe 3 months before I flagged it. I thought it was stress. We'd had a difficult rotation." "It wasn't stress." "No." The word came out flat and tight and not quite controlled. "No, apparently not." Holm turned back to the imaging. "The fracture is old enough that simple repair isn't sufficient. We're looking at a partial hip replacement and a structured rehabilitation program of 12 to 16 weeks post-surgery. The prognosis for return to pain-free function is good, provided nothing else is missed." He looked at Madison. "I want a full secondary screening before I schedule. I want to know if there are other compensatory injuries." "I can have that ready by this afternoon," Madison said. Holm nodded once. Then he looked at her. Really looked, the way the good ones did when they were updating their assessment of a room. "You caught this." "I watched him move." "The evaluating veterinarians didn't." "No." He held her gaze for a moment. "How many other dogs went through this program?" It was the question she'd been waiting for someone to ask, and the fact that it was a 61-year-old orthopedic specialist and not a federal agent who got there first said something she didn't have time to examine right now. "That's what we're working on finding out," she said. The federal agents arrived at the hospital at 10:30 with a secure laptop and a request to use the consultation room again. This time Finch had someone with her that she introduced as a forensic analyst named Tate. No first name offered, mid-30s, quiet, the kind of person who walked into rooms and immediately found the power outlets. Madison brought the drive. She'd copied everything to a fresh encrypted partition that morning, the way she'd been trained to preserve evidence, original intact, working copy for active use, documentation of the transfer chain. She handed Tate the working copy in a sealed evidence bag and kept the original. Finch watched this without comment, but her expression shifted slightly in a way that said she'd noticed. "The access attempt last night," Finch said. "Our team traced the same IP. We've got a preliminary source. It's routing through infrastructure associated with a contracted records management company called Delvane Processing. They handle storage and archival for several military veterinary program contractors." "I know that name," Madison said. "We thought you might." "They were the company processing the K-9 evaluation paperwork during my second deployment. They weren't the ones conducting the evaluations, but all the documentation passed through their system." She paused. "Including the complaints I filed." Price looked up from his laptop. "Including the responses that marked those complaints as administratively closed." "Yes." The room was quiet for a moment. "What we're trying to establish," Finch said carefully, "is the chain of authority. Who had the clearance to close a formal military complaint without a full review? That's not something a contracting company does on its own." "No," Madison agreed. "It isn't. It goes up." "I know it does. I knew it 4 years ago." She looked at her hands on the table, then back up. "That's why the complaint got closed. That's why I got reassigned. Someone with authority wanted it to disappear, and they had enough reach to make it happen quietly." Finch said, "We're going to need your deployment records, your communications from the period leading up to the complaint, anything that establishes the timeline of what you reported and when. It's in the files." All of it? I kept everything. She said it the way she'd said it the night before. Simple, factual, without the weight she was choosing not to put on it. I knew that if I didn't have documentation, I didn't have anything, so I kept documentation. Tate had opened the working copy drive and was running a verification protocol. He looked up briefly. How many files? 462 individual documents, organized by date, category, and cross-referenced by the names of the dogs and the evaluation personnel. She watched his expression. I had a lot of time on overnight shifts. Tate looked back at his screen. This is going to take a few hours. Let's take what you need, she said. Just don't lose the chain. She went back to work. It was the only reasonable thing to do, and it was also the only thing that kept her head from spinning out into the kind of anticipatory dread that was useless before anything had actually happened. She ran Rook's secondary screening. She updated 3 other patient files that had been waiting since yesterday. She helped a tech named Bree restrain a terrier who had opinions about vaccinations that he was not shy about expressing. Normal work. The kind of work she'd chosen because it kept her hands busy and her mind present and didn't ask her to be anything other than competent. She was in the hallway between Bay 3 and the medication room when her phone buzzed with a number she didn't recognize. Not the main hospital line. Not her usual contacts. A number with an area code she knew, from a geography that put her stomach very briefly into a specific kind of cold. She stepped into the medication room and answered. Ms. Reyes. Male voice, older, with the clipped, managed cadence of someone who'd given orders for a long time. I think you know this call was going to come eventually. She didn't say anything. I just want you to understand something. What you filed 4 years ago, that complaint, those records, that's old information. Incomplete information from someone who didn't have full situational awareness. You were very young. You were operating on partial data. There was context you didn't have access to. What do you want? She said. A brief pause. Like he'd expected more resistance before getting to the point and had to recalibrate. I want you to understand that cooperating with a federal investigation based on a misunderstanding isn't going to help anyone. It's going to create a lot of noise, cause damage to programs that serve important purposes, and ultimately not accomplish what you think it will. Who is this? Someone who was in a position 4 years ago to make a problem go away, and who is in a similar position now. She let a beat pass. You should be worried about the evidence, she said. Not about me. Another pause, longer this time. You've got 462 documents, he said. Give or take. The number landed like a rock in still water. She kept her face neutral even though she was alone in the medication room and no one could see her. Whoever gave you that number, she said, you should think carefully about how they got it. Because if they got it from inside a federal investigation that started this morning, that's obstruction of justice on top of everything else. She kept her voice steady. And if they got it from an unauthorized attempt to access my files last night, that's a whole different set of charges. The line was quiet. Don't call this number again, she said, and ended the call. She stood in the medication room for approximately 15 seconds, then walked directly to the consultation room and knocked. Finch opened the door. I just got a call, Madison said. 40 seconds ago. Unknown number. Male voice. Older. Very controlled. He referenced my file count. 462 documents. She watched Finch's expression change. He knew the number. Price was already on his feet. Can you lock your phone right now and hand it to Tate? She handed it over. This call happened fast, Price said, not quite to her. He was looking at Finch. Someone knew we were here. Someone knew what we pulled from the drive. The access log from last night, Finch said. They were already in motion before we arrived. We just accelerated their timeline. She looked at Madison. The voice? Was there anything distinctive? Accent, cadence, anything that felt specific? He spoke like someone who's used to being listened to, Madison said. Not like a contractor, like someone institutional. Military background, senior. Finch and Price exchanged a look that lasted about 1 second and carried a full conversation. We're going to need to move the consultation, Finch said. We can't continue working out of this hospital, not if they're tracking our activity in real time. You're not doing anything to disrupt Rook's surgical consult, Madison said immediately. We're not going to, I want that on record. Whatever else happens today, Rook's consult with Dr. Holm proceeds on schedule. That's not negotiable. Finch held her gaze. Understood. And I want a trace on that call. Already running. Price held up his own phone. But if they're smart, it'll be a burner. It won't matter if it's a burner, Madison said. What matters is that they called, that they knew the file count, that they tried to pressure me directly. She looked at both of them. That's not someone watching from a distance anymore. That's someone who's scared. The trace came back in just under 2 hours. The phone had been a prepaid device, purchased 6 weeks ago in a retail location in the city of Dunmore, 200 miles south of Varnfield. The device had been used for 4 calls total. 3 of them were to a number associated with the Delvane Processing Administrative Line. The 4th was to Madison's cell, but the cell's GPS metadata, scraped not from the call itself but from the network connection at the moment the call was made, placed the device within a half-mile radius of a building in Dunmore that Price pulled up on his laptop and then turned the screen so Madison could see it. It was a federal installation, a non-combat administrative facility for military records management, partially privatized, with contracted staff from 3 different companies. One of those companies was Delvane Processing. Finch said, "We need to escalate this to the full task force tonight." "You have a task force," Madison said. "We've had a working group for 7 months. What we're looking at now warrants the full infrastructure." Finch closed her laptop. "Ms. Reyes, I want to be direct with you. When we started this investigation, we had documentation of systemic negligence, possibly criminal negligence. Now we're looking at active obstruction, unauthorized surveillance of a federal operation, and direct intimidation of a witness." A pause. "This has gotten significantly larger than retired dogs." "It was always larger than the dogs," Madison said quietly. The dogs were just the part that was easy to see. The room was quiet. Tate, who hadn't said anything in 40 minutes, looked up from his screen. "I've completed initial verification of the files. 462 documents, all time-stamped, metadata intact, no signs of tampering." He looked at Madison. "This is clean evidence. This is very clean evidence." "I know," she said. He looked at her for a moment. "You built this like you knew it would end up in court." "I didn't know," she said. "But I planned like it might." Callan found her in Bay 2 at 4:30, sitting with Rook the way she'd been sitting with him since the night before. Not performing anything, just present. She had her back against the wall and Rook's head in her lap, and she was scrolling through nothing on her phone or trying to. He stood in the doorway without saying anything for a moment. "They won't tell me what's happening," he said finally. "They can't. It's an active investigation." "But you know." "I know some of it." She looked up. "The rest I'm finding out the same way you are." He came into the bay and sat down on the floor across from her, which surprised her. She'd had him pegged as the kind of person who needed to be standing. He looked at Rook for a while. "He's quieter today," Callan said. "The pain medication is helping. And he's not scared of this place anymore." She watched the dog's ribcage rise and fall. He figured out there were people here who weren't going to hurt him. He figured that out in about 90 seconds, with you. She didn't say anything. "I owe you an apology," Callan said. "Yesterday, what I said about wanting someone more qualified. You were scared for your dog." "That's not an excuse." She looked at him directly. "No, it's not. But it is a reason, and reasons matter." A pause. "You've spent 8 months watching him deteriorate and being told by 3 different professionals that he was fine. You walked into a new place and saw a nurse and assumed." She shrugged slightly. "You weren't wrong that I don't have a veterinary degree. But you know more than most people with one. I know different things." He looked at her. "Where? Before here?" She glanced down at Rook. "I worked with a canine rehabilitation unit for 2 years. Overseas, military contract, trauma nursing, but the unit worked with dogs that had been injured in the field. Surgery recovery, reintegration, the whole process." She paused. "I learned what dogs look like when they're in pain and trying to hide it, because that's what they were trained to do. Keep going. Don't signal weakness." A beat. It's not that different from what they train the handlers to do. Callan was quiet for a moment. Is that why you left the military? She looked at the wall across from her. I left because I found something I wasn't supposed to find, and I reported it, and reporting it turned out to be more dangerous than what I'd found. She didn't say it like a story. She said it like a fact. So I came here, started over, kept doing the work. She looked at him. Until this morning. Until Rook. Until Rook. He looked at the dog and she could see it moving across his face, the weight of what Rook had carried, what the system had done, what she'd been trying to fix for 4 years from inside a mid-sized veterinary hospital where nobody really paid attention to the nurse with the bleach stain on her scrub sleeve. The investigation, Callan said. It's bigger than Rook. Yes. How many dogs? She looked at him steadily. 14 confirmed. We think there are more. He absorbed that. His jaw worked once. How many of them are still alive? She didn't answer right away. Callan, tell me. We don't know yet. Some of them were retired 2-3 years ago. Some of them we have no information about. She held his gaze. That's part of what the investigation is trying to establish. His voice, when he spoke, was very controlled. I need you to tell me, if Rook had not come here this morning, if he'd gone another 6 months, a year, he wouldn't have made it another year, she said, not without intervention. The bay was very quiet. Rook breathed. Outside in the hallway, someone rolled a cart past, and the wheels squeaked once and then faded. Callan looked at his dog and didn't say anything for a long time. Madison didn't fill the silence. She'd learned a long time ago that some things needed the space to exist before they could be processed, and that filling that space was almost always about the person filling it, not the person who needed it. Finally, Callan said, What happens now? The investigation moves to a full task force. They're escalating tonight. She paused. And they're going to need me to be more visible, which means things are going to get complicated. What kind of complicated? She looked at her phone, which Tate had returned to her after pulling the trace data. The notification from the encrypted drive was still there in her log, time-stamped at 6:42 the previous evening. 1 failed access attempt, 1 call this morning. The speed of it was what kept sitting wrong with her. Not just that they'd moved fast, but that they'd known exactly where to look. Someone inside the investigation has a leak, she said, or someone connected to it does. Callan went very still. The agents. I don't know. Maybe not them directly, but the file count, that number came from somewhere. Either someone accessed the drive before my security locked them out and counted the files, or someone was monitoring Tate's work this morning in real time. She looked up. Either way, we have a problem that goes deeper than the contracting company. He looked at her. Is that information you should be telling me? Probably not, she said. But you're in this now. Rook put you in it the moment he walked through those doors, and you should know what you're standing next to. He held her gaze for a long moment. Then his phone rang. Not his personal number. The secondary line, the one, she could tell from how he looked at it, that he'd had for specific purposes and hadn't expected to hear from tonight. He looked at the screen. His face went very still. Who is it? She asked. He turned the phone so she could see the screen. The contact name read, Kessler, D, classified. He answered on speaker without her having to ask. The voice on the other end was taut and clipped, and about 3 seconds from something she couldn't name yet. Voss, I know where you are. I need you to listen very carefully. A breath. They're not just covering up the evaluations. They were running a secondary program. The dogs weren't just being cleared. Some of them were being deliberately kept in pain, kept aggressive, and then sold. The bay was completely silent. Sold to who? Callan said. The voice on the other end didn't answer right away. And in that pause, Madison's phone buzzed with an alert from the encrypted drive. Someone was trying to access it again. This time, they were getting closer. The second access attempt failed the same way the first one had. The system locked, logged, and pushed an alert. But this time Madison could see in the metadata that whoever was trying had gotten further, not into the files, but closer to the partition boundary than they'd been 16 hours ago. She stood up from the floor of Bay 2 with her phone in her hand and held it out so Callan could see the alert. He was still on with Kessler, who had gone quiet on the other end in a way that felt less like hesitation and more like he was listening for something on his side of the call. "Kessler," Callan said, "someone's trying to access Madison Reyes' files right now, in real time. Can you tell me if that's connected to what you're describing?" A sound on the other end. Not quite a word. "Yes," Kessler said finally, "and that means they know you're together, which means you need to move. We're in a hospital. I know where you are. That's the problem." A pause. "The program I'm describing. I can't give you the full scope on an open line. I need a secure location, and I need to be there in person. But I want you to understand the scale of what we're talking about before you decide whether to walk toward this or away from it." "We're not walking away," Callan said. Madison hadn't told him to say that. He'd said it anyway, and she filed that away without comment. The evaluations, the fraudulent clearances, those were the front of it, the mechanism that made the rest possible. Kessler's voice dropped. Dogs that were cleared as healthy but weren't. Some of them were being funneled into private security contracts. High value, off book, aggressive animals, pain conditioned, sold to contractors who didn't ask about medical history because what they wanted was dogs that would bite on command and couldn't be easily managed by anyone who hadn't been briefed on how to handle them. The bay was very still. "They were manufacturing attack dogs," Madison said. "Not a question." "They were monetizing the ones they'd already broken," Kessler said. "There's a difference, but not a comfortable one." Callan's hand on the phone had gone white at the knuckles. "Rook," he said. "Rook was on the list," Kessler said. "He didn't ship because his aggression patterns were flagged as unpredictable, too handler-specific. He'd respond to you and almost no one else, which made him less valuable for the program's purposes." A pause. "That's why he ended up in your custody. He was a failed product." The silence that followed that sentence lasted long enough to become its own kind of answer. "I'm calling Finch," Madison said, and walked out of the bay. Finch picked up in one ring, which told her the agent was still working, still wired, still fully inside the operational tempo that the last 12 hours had set. "Second access attempt on my files," Madison said, simultaneous with a call to Callan Voss from a contact named Kessler, who claims to have information about a secondary program, private sale of pain-conditioned military dogs to off-book security contractors. Silence on Finch's end. Then, "D. Kessler, former logistics officer, 7th Group Support Division. He's been on our periphery for 3 months. We couldn't get him to talk." "He's talking now." "Because they're moving. If they're trying to access your files again tonight, they're not waiting to see how this develops. They're trying to clean house before we can build the full picture." Finch's voice was sharp and fast. "I need Kessler's location, and I need you and Voss out of that hospital." "I'm not leaving Rook." "Madison, the surgical consult is tomorrow morning. I'm not leaving him overnight without someone he trusts in the building. He's on pain medication, and he's in an unfamiliar environment, and he's been through enough." She kept her voice level. "Get Kessler. Escalate whatever you need to escalate. I'll be here when you need me." A short pause. "I'm sending someone to sit on the building tonight." "Fine. Don't answer any more unknown calls." "I won't." She almost added something else, then didn't. "Finch. The file count, 462. The man who called me this morning knew that number. Has anyone on your team discussed specifics over an unsecured line in the last 24 hours? The pause was fractionally longer than it should have been. "We're looking at that," Finch said. "That's not a no. It's not a yes either. We're looking at it." A beat. "I'll have someone at your location within the hour." Madison ended the call and stood in the empty hallway for a moment, looking at the row of closed bay doors, the motion sensor light at the end of the corridor doing its patient, automatic work. The hospital was quiet in the way hospitals were quiet after hours. Not silent, but reduced. The overnight tech was at the back desk. The animals in recovery were breathing. The monitors ran their slow, steady cycles. She went back into Bay 2. Callan had ended his call with Kessler and was sitting with his back against the wall and Rook's head across his legs. He looked up when she came in, and his face had the specific kind of stillness that came from being very angry and choosing not to do anything with it yet. "He'll meet with the agents," Callan said. "Tomorrow. He wants immunity. That's their problem to sort out." She sat down across from him. "Are you okay?" He looked at her. "Wrong question," she said. "Are you functional?" "Yeah." He looked down at Rook. "A failed product." That's what he said. "I know." Rook ran 3 combat deployments. He found IEDs that would have killed 12 people. He did everything they asked him to do, and then they decided he was worth something as merchandise. His jaw worked. And the only reason he ended up with me instead of in some contractor's kennel was because he loved me too much to respond to anyone else's commands. Madison didn't say anything immediately. She let the sentence exist. "They couldn't monetize his loyalty," she said finally, "so they threw him away. And you caught him." Callan looked at her. It wasn't the response he'd been bracing for, and it landed differently because of that. "Get some sleep if you can," she said. "I'll be here all night." "You don't have to." Oh, I know I don't have to." She looked at Rook. "I want to." He studied her for a moment with the expression of someone revising an estimate they'd already revised twice. Then he nodded once, lay down on his side on the padded floor, and closed his eyes. Madison sat against the wall with the encrypted drive in her hand and watched Rook breathe. Kessler arrived at the federal field office in Varnfield at 7 the next morning, which Madison knew because Finch called her at 7:20 to say the interview was in progress and they were moving faster than expected. She was already prepping for Rook's surgical consult. Dr. Holm arrived at 8:10 with a resident she introduced as Dr. Pavel, who was young enough that Madison automatically checked whether he'd done the pre-surgical review and experienced enough relief when the answer was yes, that she felt slightly guilty about it. The 3 of them, Madison, Holm, Pavel, ran through the secondary screening results in the consultation room while Rook waited in Bay 2 with Callan. "Secondary imaging confirms no additional fractures," Madison said. "There's significant muscle atrophy along the left hindquarter, consistent with months of compensation. I've got baseline blood work from yesterday and this morning, and the inflammatory markers are elevated but not at a level that complicates the surgical window." Holm looked at the scans. "Any cardiac concerns?" Echo was clean. "He's in better shape than he has any right to be, given what he's been carrying." Holm nodded slowly. "We schedule for Thursday. I want 2 more days of anti-inflammatory preparation before I open that joint." He looked at Madison. "You'll be in the room?" "If Dr. Holst approves it. I'm requesting it. I want someone who knows this animal's behavioral cues in case we have any complications during induction." He said it like it was a clinical decision, which it was, and also like it was an acknowledgement, which it also was. She said she'd be there. She was walking back toward Bay 2 when Petra caught her in the hallway with the look she'd been wearing since yesterday, the one that had too many things in it to be one expression. "2 men in the parking lot," Petra said quietly. "Dark sedan. They've been there since 5 this morning. Finch sent them." "I know. I called her at 6 to check." Petra looked at her steadily. "Madison, I need you to understand something. Whatever is happening, whatever this investigation involves, this hospital can't be in the middle of it indefinitely. I have staff who are frightened. I have clients who've noticed the federal presence. I've had 3 calls this morning from people asking if we're under some kind of inspection." "I understand. Do you have a timeline?" "No, but things are moving." She met Petra's eyes. "I'm sorry, I didn't choose this location. Rook chose it." Petra held her gaze for a moment. "I know that. I'm not asking you to leave. I'm asking you to keep me informed." A beat. "I'm also asking because 2 of my techs asked me this morning whether you were in danger, and I didn't know what to tell them." Madison absorbed that. "Tell them I'm fine," she said, "and that Rook is going to be okay. That part they can focus on." Petra nodded once and walked away. Madison's phone buzzed. "Finch?" She answered. "Kessler's talking," Finch said, "and what he's describing is going to require us to move faster than we planned. I need you at the field office in 2 hours. I have a patient." I know, 2 hours. It'll take 90 minutes. A pause. Madison, Kessler has named names, specific names with documentation he's been holding for 18 months. There's overlap with your files. When we cross-reference what you've built with what he's bringing, we'll have enough to move on warrants. Her voice was controlled, but underneath it something was pressing. We're at the point where this either comes together or it falls apart, and which one happens depends on the next 12 hours. Madison was quiet for a moment. Who are the names? Finch said, "There's a senior officer, Colonel Victor Kane, Defense Logistics Oversight based out of the Dunmore facility. He's the one who—" "He signed the order closing my complaint," Madison said. Complete silence on the other end. "You have documentation of that," Finch said. "File 217, signed dismissal order with his name on it, dated 11 days after I submitted the complaint." She kept walking, kept her voice even. "He's in my files, Finch. He's been in my files for 4 years. The pause that followed had weight to it, the specific weight of a case that had just shifted from building to built. 2 hours, Finch said. "Please." "Okay." She was at the field office by 10. The room they used was larger than the consultation room at the hospital. An actual conference table, a projector, 4 agents she hadn't seen before, plus Finch and Price and Tate, who looked like he hadn't slept. Kessler was there too, a compact man in his late 40s, with the kind of face that had been under sustained stress for long enough that it had settled into it. He looked at Madison when she walked in and nodded once, the way you nodded at someone who'd been carrying the same thing you had for longer than was reasonable. Finch ran the meeting. She didn't waste time on preamble. Kessler has provided testimony and documentation covering a 40-month period of fraudulent retirement clearances, secondary sales of military working dogs to 3 private security contractors, and a financial distribution network routing payments through Delvane Processing. She put a file on the table. Madison Reyes' documentation covers the originating complaint, the suppression of that complaint, and the evaluation falsification methodology. Together, they establish a complete chain of events from inception to present. One of the new agents, older with a senior investigator's particular economy of expression, said, "What's the exposure on Kane specifically?" "Fraud, obstruction, abuse of authority, falsification of military records, conspiracy to commit animal cruelty under federal statute, which sounds minor until you factor in the interstate commerce element, at which point it becomes a serious federal charge." Finch looked at her notes. "And based on the financial routing Kessler's identified, potential wire fraud. The payments to Kane were structured to look like consulting fees from a private veterinary education foundation. He was getting paid," Madison said, "quarterly, for 3 years." She looked at the table, not because she was surprised. She hadn't been surprised since she'd first seen his name on the dismissal order, but because there was something about hearing it stated out loud in a federal conference room that made it real in a different way than it had been before. "He buried my complaint," she said. "He reassigned me. He let those dogs spend years in pain and then sold the ones he could sell and cleared the rest on paper. And he was collecting consulting fees from a foundation that didn't exist." She looked up. "What do you need from me today?" "We're executing a warrant on the Dunmore facility at 4 this afternoon," Finch said. "We want you here as a technical consultant during the document review. You know your files well enough to cross-reference in real time, which saves us hours. And we may need you available for a recorded statement later today." "That's fine." "There's one complication." Finch glanced at Price, then back at Madison. "When we pull the Dunmore records, Kane will know within minutes. He likely already knows something is moving. The access attempts on your files, the speed of their response yesterday, all of it suggests he's been monitoring the investigation through whatever contact he has. When the warrant executes, he'll move to whatever contingency he's been preparing." "What does that mean practically?" Madison asked. "It means the next few hours are the most dangerous part," Price said. "Before we have him in custody, he has options. And people with options who are about to lose everything make decisions that are hard to predict." Madison thought about the phone call from the morning before, the controlled voice, the reference to her file count, the confidence of someone who believed they were still in a position to manage outcomes. "He's going to try to discredit the evidence," she said. "That's one option. Or he's going to try to discredit me." She said it flatly. "What's in the works?" What have you flagged? Finch and Price exchanged that look again, the 1-second look that carried a full sentence. Yesterday afternoon, Finch said, we intercepted a document being routed through the Delvane system. It's a falsified personnel record. It's designed to suggest that Madison Reyes, while serving in the military, was complicit in the same evaluation fraud she reported. The room was very quiet. They're going to say I was part of it, Madison said. They're going to try to introduce that document into the evidentiary record before we can have it forensically examined, Finch said. If it gets filed in the right place before we can prove it's a forgery, it complicates your testimony, potentially disqualifies it. Madison looked at Tate. How long does forensic document analysis take? On a digital file with full metadata, 2 to 4 hours if we have it now. He looked at her. Do we have it? Finch pulled the document up on the projector. Madison looked at it for a long moment. Her own name, her own service number, her own unit designation. The dates were wrong by 11 days. She could see it immediately, the way anyone who'd kept 4 years of chronological records could see it. The signature block used an administrative format that hadn't been in use during the period the document claimed to be from, and the evaluation case number it referenced didn't match the numbering system she'd documented in File 104. It's a forgery, she said. We believe so. I can tell you specifically how it's wrong. Tate, I need you to pull File 104 from the working copy and cross-reference the case numbering sequence. The format changes in this document don't align with the administrative protocol that was in place during that period. I can walk you through it line by line. She was already moving. How much time do we have before they try to file it? Tate looked at Finch. Finch looked at the clock on the wall. The warrant executes at 4, Finch said. If they're going to move preemptively, they move before then. Madison looked at the clock. It was 11:47. Then we have 4 hours to prove this document is fabricated, she said. Let's not waste any of them. They worked fast and without ceremony. Tate pulled the files. Madison walked him through the case numbering discrepancy in 17 minutes, and he had the timestamp analysis running in parallel before she'd finished explaining the administrative format issue. Price was on the phone coordinating with the team running the Dunmore warrant. One of the other agents was working the financial routing with Kessler, who sat across the table drinking bad coffee and answering questions with the particular exhaustion of someone who'd been carrying something heavy for too long and was finally, incrementally, putting it down. At 1:15, Tate looked up from his screen. The document was created 14 days ago, he said. The metadata timestamp is falsified. Someone altered the creation date, but the embedded font data and the rendering engine signature place it in a software version that didn't exist until 8 months ago. He looked at Madison. This document is newer than the software used to create it is supposed to be. That's your forgery confirmation, Madison said. That's my forgery confirmation. He started typing. I'm preparing the forensic report now. We can have it certified and filed with the court before 2 o'clock. She sat back. Around the table, the room kept working. Phones, laptops, the projector cycling through documents. The machinery of an investigation that had been building for 7 months and was now, in the space of less than 48 hours, coming to the moment everything either held or didn't. Her phone buzzed. A text from Callan. Rook ate this morning. First time in 3 days he finished his food. She looked at it for a moment. Something in her chest did the thing it had been doing since the morning before. The warm, complicated, not quite articulable thing that she'd been keeping carefully separate from everything else that needed her attention. She typed back, "Good. I'll be there before tonight." At 2:40, Finch came back into the conference room from the hallway with her phone in her hand and her expression doing something that Madison had learned to read as contained urgency. "The warrant team is in position," Finch said. "We're pushing the execute time to 3:30. Kane is at the Dunmore facility." She looked at Madison. "He's been there since this morning. He hasn't left." "He's waiting," Madison said. "For what?" She thought about the phone call, the controlled voice, the confidence, the reference to her file count, not as a threat exactly, but as a demonstration. "I know what you have. I know where it is. I know more than you think." "He thinks he has something left to use," she said. "Something he hasn't played yet." Finch's phone rang. She answered, listened for approximately 4 seconds, and the controlled urgency in her face shifted into something sharper. "When?" she said into the phone. A pause. "Get everyone out of the building, now." She ended the call and looked at Price. "There's been an incident at the Dunmore facility. Someone triggered an internal file deletion protocol 40 minutes ago. They're purging the records archive." The room went very loud, very fast. Madison was already on her feet. "How long does the deletion take?" "The system is designed to complete in 90 minutes, one of the other agents said, "which means it started at 2 o'clock, Madison said, "while we were certifying the forgery." He'd known. He'd known the forensic report was coming. He'd known the warrant was moving. And he'd set the deletion running before they could get to the physical records, as a contingency, as a scorched earth measure, as the last option of someone who understood that if the paper trail survived, nothing else he had would matter. "Can the deletion be stopped remotely?" Price asked. "Not without administrative credentials we don't have. Physical interruption? The warrant team is 12 minutes out." Finch was already on her phone again. The room was moving. People on calls, pulling on jackets, the particular organized chaos of a task force shifting from preparation to execution. Kessler stood up from the table with his coffee still in his hand, looked around at the controlled emergency happening around him, and set the coffee down. Madison stood in the middle of it with one clear thought. The physical records were Kane's records. The documentation that existed on his side of the operation, the financial routing, the internal communications, the approval signatures that would place him at the center of the network rather than at its edges. Her files were safe, but without his records to corroborate the full financial structure, the case against Kane specifically, not the contractors, not the mid-level operatives, but Kane, got harder. She pulled up the file index on her tablet, 462 documents. She scrolled to section 7, which she'd labeled 4 years ago, on a 12-hour overnight shift with nothing but time and the specific clarity that came from being genuinely angry about something that deserved it, administrative authorization chain. She found what she was looking for in file 341. "Finch," she said. The agent turned. "When Kane signed the order closing my complaint, he routed a copy to the Delvane Administrative Archive. Standard procedure. Any formal complaint closure required dual filing. Military record and contracting record." She held up the tablet. "I have a photograph of the original, date stamped, his signature, his authorization code, and the Delvane case number assigned to the filing." She looked at Finch. "If they're deleting the Delvane records right now, they're deleting the copy, but the original military record has to exist somewhere else." "It was supposed to be expunged from the military system when you were reassigned," Price said. "It was supposed to be." She looked at him. "But Kane used a Delvane case number on a military document. That's a cross-system filing. Military records and contracted records are maintained under different protocols. If Delvane purges their copy tonight, the cross-reference in the military system becomes an orphan file, a record that points to something that no longer exists, which is itself evidence of deletion." Finch stared at her. "You can't fully delete something that was filed in 2 systems without leaving a ghost in the one you didn't control," Madison said. "He doesn't own the military records archive. He only owns Delvane." The room had gone quiet again. A different quiet than before, the kind that preceded a decision. Finch looked at Price. Price pulled out his phone. "I need the DoD Records Division on the line," he said. "We need an emergency hold on all files associated with case number." Madison read the number from file 341. Price repeated it into the phone. And then the warrant team called in from Dunmore. Finch answered on speaker. The voice on the other end was flat and operational. "We're on site. Facility is locked down. We found Kane." A pause, short and strange. "But there's a problem. He's not at the records archive. He's in the main conference room with 2 individuals we don't have on file, and one of them is military. Senior officer insignia." Another pause. "And Kane is asking to speak to someone named Reyes." Everyone in the room looked at Madison. She looked at Finch. "He wants to negotiate," Madison said. "He thinks he still has something to offer." "Does he?" She thought about Rook, about the fracture in the imaging films, about 14 confirmed dogs and however many they hadn't found yet, about 4 years of a drive she'd been updating in the dark, waiting for exactly this moment. "No," she said. "He doesn't." Finch looked at her for a long moment. "Are you willing to go to Dunmore?" And before Madison could answer, Tate looked up from his screen with an expression that stopped the room completely. "The military records hold went through," he said, "but someone accessed Kane's personnel file 30 seconds before the hold was placed." He turned his screen so the room could see it. "They didn't read it. They added something to it." He looked at Madison. "A witness statement, dated today, attributed to you." His voice was very careful and very controlled. "It retracts your original complaint and states that your 2021 report was filed in error." The silence was absolute. Someone had just put her name on a document she hadn't written, retracting the only formal complaint that existed, inside a system that had just been placed under an emergency hold. And Kane was 200 miles south, waiting in a conference room, asking for her by name. "Pull it," Madison said. Tate looked at Finch. Finch looked at Madison. "I can't authorize deletion of a file that's already inside the hold," Finch said. "Once it's in the protected system, I'm not asking you to delete it. I'm asking you to flag it as contested and timestamp that flag right now before it propagates to any secondary index." Madison was already moving toward Tate's station. "If that statement sits in the system unchallenged for more than a few hours, it gets treated as filed. Contested documents get held pending review. That's the difference between a problem we can fix tonight and a problem that takes 6 weeks in front of a federal magistrate." Tate was already typing. "Flagging it as contested requires a formal counter-declaration. Then prepare one." She looked at Finch. "I'll sign it right now. I need a statement that says I did not author or authorize any retraction of my 2021 complaint, that my original documentation stands, and that the document inserted into the system was placed there without my knowledge or consent." "That's a sworn statement," Price said. "I know what it is." He looked at her for a moment, not doubtful, more like he was checking the load-bearing walls of a structure before walking into it, and then nodded at Tate, who had the template up in under 30 seconds. She read it once, confirmed every line matched what she'd said, and signed it. Tate filed it at 3:14. The timestamp locked at 3:14 and 41 seconds. "How long does propagation take?" she asked. "For a document to replicate across all nodes in the hold system?" He did the math. The contested file was inserted at roughly 3:02. Counter-declaration filed at 3:14. That's a 12-minute window during which the retraction existed unchallenged. He looked at her. "It may have already hit 2 secondary indexes. Can we see which ones?" "Working on it." Finch put a hand on Madison's arm. "Not restraining, just present. The counter-declaration is strong. Your original files establish the timeline independently of the military record system. Even if the retraction hits secondary indexes, the forensic evidence of when it was inserted, combined with the forgery we've already certified, creates a clear picture of fabrication." She paused. "Kane is throwing everything he has left." "Because he's out of options," Madison said. "Which means he's about to make a mistake." She looked at the screen showing the Dunmore facility feed, the warrant team's body camera, grainy and wide, showing a hallway and the closed door of the main conference room. "I'll go." "Madison." "He asked for me specifically. If I'm not there, he stalls. He runs out the clock on whatever he thinks he has left to negotiate with." She looked at Finch directly. "I've been building toward this conversation for 4 years. I'm not going to miss it because it's inconvenient." Finch held her gaze for a long moment. "You go in wired," she said. "My people are in the room. You don't negotiate anything. You don't make any representations about the investigation. And if he says anything that sounds like a threat, you walk out immediately." "Agreed." "And you're not doing this alone." Finch looked at Price. "I want you in the car with her." Price was already reaching for his jacket. The drive to Dunmore was 1 hour and 40 minutes on a clear highway. Madison spent the first 40 minutes reviewing her files on her tablet. Not the ones she'd already covered with the agents, but the ones in Section 9, which she'd labeled Systemic Context, and almost never opened because opening them meant sitting with the full scope of what she'd known for 4 years and couldn't act on. She read through them now, methodically, the way she'd read everything, not for the emotion of it, but for the details, because the details were what held. Price drove and didn't try to fill the silence, which she appreciated. At the 45-minute mark, she put the tablet down. The two individuals with Kane, she said, the ones the warrant team couldn't identify. Any update? Working on it. Price glanced at the mirror. One of them has been identified. Former JAG attorney, currently in private practice. Kane's personal legal counsel, most likely. A pause. The other one is still unconfirmed. The insignia on his uniform is real. The serial number on the rank insignia checked out. But his name isn't appearing in active duty rosters at the Dunmore facility. He's been brought in from somewhere else. That's what we think. Kane called in a favor, she said. He's got someone senior in the room as a character witness or as a pressure play. Someone who can speak to his service record, his reputation, whatever he thinks makes the financial and fraud charges look less clean. That's our read too. It won't work. She looked out the window at the highway median, the flat gray of the Oregon interior passing at 70 miles an hour. Whatever his service record says, the financial routing Kessler documented is specific. The case numbers in my files are specific. Character doesn't touch wire fraud. I know. Price paused. Are you going to be okay in that room, seeing him? She thought about it honestly. I don't know. I haven't been in the same room as the person who ended my military career before. She looked at the road ahead. But I've been in rooms with people who were in a lot more pain than I was, and the job got done, so probably yes. That's either very healthy or very not healthy. Probably both, she said. Oh, the Dunmore facility was a low, wide building in administrative beige, the kind of architecture that communicated nothing and apologized for nothing, and had been designed entirely to house files and personnel and not to be looked at. There were 3 federal vehicles in the parking lot, 2 marked, 1 not, and the warrant team lead, a woman named Oster, who had the compact authority of someone who'd run a lot of these and had stopped being impressed by them, met them at the entrance. Kane's been cooperative on the surface, Oster said as she walked them in. He's had 2 private consultations with the JAG attorney. He hasn't asked for anything overtly, but he's been very specific about wanting to speak with Reyes before he'll discuss any of the documents our team pulled. What did you pull? Price asked. Enough. The deletion ran for about 22 minutes before we physically interrupted the system. They got maybe 30% of what was in the archive. She looked at Price. 60% of the original files are intact, including a batch of internal communications from a 14-month period that our team hasn't fully reviewed yet. But preliminary scan shows Kane's name in the authorization headers of 43 documents related to evaluation clearances. His name directly, Madison said. His name and his access credentials. Someone logged into the system as him and approved those evaluations. Oster pushed open a door to whether that was him personally or someone using his credentials is something legal will argue about for months. But the digital footprint is there. They went down a hallway with overhead fluorescents that buzzed faintly at the wrong frequency and stopped outside a door with 2 agents posted at it. Oster looked at Madison. Ready? Yes, Madison said. And then, because it was true and because she'd learned a long time ago that ignoring true things didn't make them less true. And no, but we're going in anyway. Colonel Victor Kane was 63 years old and looked like someone had built him to fill a uniform. Broad through the shoulders, gray at the temples, with the kind of face that had spent 40 years in institutional contexts and had learned to present a specific version of itself in all of them. Measured, credible, the face of a man who gave orders and received deference. He was in civilian clothes, which seemed like a deliberate choice. The JAG attorney sat to his left. The unidentified senior officer sat to his right, also in civilian clothes now, jacket off, rank insignia absent. Someone had advised them both to dress down. The 4th person in the room was someone Madison hadn't expected. A woman in her 50s with a federal prosecutor's ID on a lanyard around her neck, sitting at the far end of the table with a notepad and the expression of someone who was here to observe and had already seen enough. Madison sat down across from Kane. He looked at her for a moment with an expression she'd been trying to prepare for and hadn't quite managed. Not cold, not contemptuous. Almost something like recognition, like he was seeing someone he'd underestimated at a distance for 4 years and was now calibrating for the difference. Ms. Reyes, he said. Colonel? I understand you've been very thorough. I try to be. The JAG attorney put his hand on Kane's arm, which meant don't. Kane ignored it. What you found 4 years ago, Kane said. The evaluations. You weren't wrong about what was happening. I want to acknowledge that. She waited. The program that developed, it wasn't designed the way it ended up. There were systemic pressures, funding gaps, contractors who found efficiencies that turned into something worse. He kept his voice even and reasonable. The voice of a man presenting a complex situation to someone who he hoped was still persuadable. What I did was try to manage a situation that had already become uncontrollable. Closing your complaint wasn't about protecting criminals. It was about buying time to address the problem internally. The problem, Madison said, was that injured military dogs were being fraudulently cleared as healthy and then sold to private contractors. That was the problem. That's one frame. It's the accurate frame. She didn't raise her voice. You bought time for 3 years. During those 3 years, 14 confirmed dogs were cleared on fraudulent evaluations. Some of them died. Rook was on a sale list, and you received quarterly payments from a shell foundation that doesn't exist. She looked at him steadily. What problem exactly were you managing? The JAG attorney said, my client is prepared to discuss terms. Your client inserted a document into a federal record system 2 hours ago with my name on it, Madison said. He fabricated a retraction of my 2021 complaint and filed it under my credentials. That's obstruction of justice added to everything else. She looked at the federal prosecutor at the end of the table. I assume that's already been noted. The prosecutor wrote something on her notepad without looking up. Kane's jaw had tightened very slightly. The control was still there, but it had become effortful, and that was different than before. The document you're describing, the attorney started, was forensically confirmed as a forgery at 2:50 this afternoon. The metadata analysis and rendering engine signature are in a certified report that was filed with the court before 3 o'clock. Madison looked at Kane. Whatever you were hoping that document would accomplish, it's already done the opposite. Every action taken to discredit me or suppress the evidence since yesterday morning is now part of the evidentiary record, including the phone call you made to my cell from a prepaid device yesterday morning. The room was quiet. Kane said, You can't prove that call came from me. The device was purchased 6 weeks ago in Dunmore. It called the Delvane administrative line 3 times before it called me. The GPS metadata places it within a half-mile of this building. She paused. We can't prove it came from your hand. We can prove it came from your facility. On the same morning, federal investigators were at my location, referencing a specific piece of information, my file count, that was only accessible to someone who had either breached my security system or been briefed by someone who did. She kept her eyes on his. How many people did you brief, Colonel? He didn't answer. That was its own answer. She was outside within 20 minutes. Not because the meeting had ended. It was still technically ongoing, the attorney working through language with the prosecutor, Kane maintaining his performance of a reasonable man in a complicated situation for an audience that had already stopped believing it. But she'd said everything she'd come to say, and staying longer would have been about her anger rather than the case, and she'd had enough practice distinguishing between the two. Price was waiting in the hallway. How are you doing? He asked. Fine. She meant it, more or less. The attorney is going to push for a cooperation agreement. Kane has information about the contractors that goes beyond what Kessler knows. He's going to try to trade it. That's the prosecutor's call. I know. She looked at the closed door. He's not going to walk. Whatever deal they negotiate, the charges are too serious and the documentation is too clean. He might reduce his exposure. He's not going to eliminate it. No, Price agreed. He's not. Her phone buzzed. Tate. Secondary index confirmation. Retraction document hit 2 indexes before the contested flag went through. Both indexes have now been updated with the counter declaration. The forensic report has been attached to both. Legal team says the retraction has 0 evidentiary weight. The fabrication is too clear. You're clear. She read it twice. Then she typed back. Understood. Thank you. She looked up at Price. We're clear on the retraction. Good. He studied her. Most people who'd been through what you've been through in the last 48 hours would look a lot worse than you do right now. Most people haven't had 4 years to prepare. Is that what it was? Preparation? She thought about the overnight shifts, the files, the drive in the locked box. The way she'd kept updating it even when there was nothing happening, even when it felt like screaming into a very small container that nobody would ever open. Mostly, she said, and partly just not being able to let it go. He nodded like that made sense to him. It probably did. Her phone buzzed again. This time, it was Callan. Dr. Holm moved the surgical consult up. Rook goes in Thursday morning, 7 a.m. They want you there. She typed back, I'll be there. Then she followed Price back toward the entrance, past the fluorescent lights that buzzed at the wrong frequency, past the doors that led to the records archive where 60% of Kane's documentation still sat intact and 43 authorization headers still carried his name, into the parking lot where the late afternoon had turned the Oregon sky a flat, particular gray that meant rain before evening. It wasn't over. There were warrants to be executed, contractors to be charged, a task force that would spend months working through the full scope of a network that had been running for 3 years under the specific protection of a man who'd signed a dismissal order and then collected quarterly payments and told himself he was managing a situation. But the fracture had been found, and everything built on top of a fracture, all the weight, all the structure, all the careful maintenance of a surface that looked stable, was already coming down. The task force moved on the contractors 4 days later. Madison wasn't present for the arrests. She was in the surgical suite at Harlow Peak, gloved, standing at Rook's head during induction, talking to him in the low register that had worked in the lobby and kept working every time since. Dr. Holm worked with the specific economy of a surgeon who'd done this long enough that the movements had become precise without becoming mechanical. Pavel handled retraction. The anesthesiologist, a quiet, focused woman named Dr. Sue, managed the sedation with the kind of attention that made Madison's own job easier, because a well-managed sedation meant the animal was stable, and stable meant predictable. And predictable meant she could put her full attention on Rook's vitals and behavioral cues rather than dividing it. The procedure took 3 hours and 14 minutes. When Rook came out of anesthesia and recovery, he lifted his head and his eyes found Madison before they found anything else in the room, and she put her hand on his neck and said, "You did good," and he dropped his head back down and slept. The arrests had been coordinated across 3 states. The primary contractor, a man named Feld who ran a private security operation out of a facility in Nevada, was taken at his office building with enough documentation from the Dunmore records and Kessler's testimony to make bail an abstract concept for the foreseeable future. 2 subsidiary contractors were picked up the same morning. Delvane Processing was placed under federal administrative control pending a full audit. Kane was formally charged at 9:17 a.m. on the same morning as the contractor arrests. Fraud, obstruction of justice, abuse of authority, falsification of military records, conspiracy, wire fraud. The list ran to 11 counts, which the federal prosecutor's office released in a statement that made regional news by noon and national news by 4. Madison read the statement in the break room at Harlow Peak between a post-surgical check on Rook and an afternoon appointment she'd been covering for a colleague. Callum had printed it out and left it on the table with a note that said, "Thought you'd want to see this in handwriting that was slightly larger and more deliberate than usual, the way handwriting got when someone was trying to make a moment feel appropriately sized." She folded it and put it in her pocket. Petra found her in the hallway 20 minutes later. "I just got a call from Agent Finch," Petra said. She wanted me to know the investigation was moving into its formal prosecution phase and that, her words, the hospital had been helpful beyond what they had any right to expect. That's generous. But she also said you'd probably understate it if she told you directly. Petra looked at her. "So she told me to tell you that the case against Kane is, again her words, airtight." A beat. She seemed like she meant it. "Finch doesn't say things she doesn't mean." "No," Petra agreed. "She doesn't seem like someone who does." She looked at Madison for a moment. "How are you?" "Tired." It was the first fully honest answer she'd given to that question in several days. "And fine, both." "Rook?" Procedure went well. He's in recovery. Holm thinks the prognosis is excellent if the rehabilitation protocol holds. Petra nodded. Then, there's something else. Someone from the DOD Inspector General's office called the main line this morning and asked for you. Not Finch, someone else. A department director. They left a number and asked you to call back at your convenience. She handed Madison a slip of paper with a name and a number. I don't know what it's about. Madison looked at the name on the slip. She didn't recognize it, which meant it wasn't anyone she'd filed complaints against or been ignored by, which narrowed the field considerably. I'll call them, she said. Dicked. She called from the parking lot at the end of her shift, sitting in her car with the engine off and the last gray light of the afternoon coming through the windshield. The director's name was Harmon. He had the careful, deliberate manner of someone who chose words the way engineers chose materials, for load-bearing capacity, not aesthetics. Ms. Reyes, he said, I'll be direct. The documentation you preserved and provided to the investigation is the most comprehensive piece of evidentiary work our office has seen in connection with a military program abuse case in quite some time. The quality of it, the organization, the chain of custody, the cross-referencing, that's not accidental, that's deliberate. Yes, she said. The investigation also identified significant failures in the military working dog retirement oversight process that go beyond the criminal conduct of specific individuals. The system itself has gaps that allowed this to happen and that without intervention would allow it to happen again. A pause. We'd like to talk to you about a consulting role, specifically assisting in a comprehensive review of canine medical evaluation protocols, identifying where the oversight failures occurred and what a corrective framework should look like. She was quiet for a moment. I'm a veterinary nurse in Varnfield, Oregon, she said. You're a military trauma nurse with 2 years of direct experience in canine rehabilitation programs who identified systemic fraud before anyone else did and preserved the evidence to prove it for 4 years, Harmon said. The title on your current employment record is somewhat incidental to what we're actually discussing. She looked through the windshield at the parking lot, the dry cleaner next door, the $8 an hour garage, the corner of Mercer and 14th. I'd want it structured so that I can maintain my work here, she said. I have responsibilities I'm not willing to walk away from. We'd expect that to be a condition of any arrangement. And I'd want formal acknowledgement, on the record, not internal, that my 2021 complaint was valid, that its closure was improper, and that the personnel actions taken against me following the complaint were retaliatory. A pause. Longer than the others. That acknowledgement, Harmon said, is already being prepared. She let that sit for a moment. Send me the details of what you're proposing, she said. I'll review them. We will. A brief pause. Ms. Reyes, what you did, preserving that documentation when you had every reason not to, when there was no indication anyone would ever act on it, that took a particular kind of persistence. Or stubbornness, she said. Depending on how it turned out. He almost laughed. Not quite. Thank you for your time. We'll be in touch. She ended the call and sat in the quiet car for a while. The encrypted drive was in her bag. Force of habit. She'd been carrying it since 2 mornings ago, the way she'd been carrying it metaphorically for 4 years. She took it out and looked at it. Matte black, no markings, smaller than a finger. 462 documents. Callan was in Bay 2 when she came back in. He'd been spending evenings there since the surgery. Not all night, but long enough that the overnight tech had stopped noting it as unusual. Rook was on the padded floor with his head in Callan's lap, breathing in the slow, even way of an animal in real rest for what was probably the first time in a very long time. Madison sat down on the floor across from them without being asked. Charges went through today, Callan said. I saw. 11 counts against Kane. Yes. He looked at Rook for a moment. How many dogs total? Do they know yet? 31 confirmed across the program. Evaluation records accessed under fraudulent clearances. Of those, she paused because this was the part that didn't have a clean answer. 19 are still alive. 12 have died in the last 3 years, mostly from secondary complications of untreated injuries. She watched his face. Every surviving dog is being reevaluated under the new emergency protocol the IG office put in place this afternoon. Full imaging, independent veterinary review, no contractors involved. Callan absorbed that without speaking. Rook's one of 19, he said finally. Yes. He put his hand on Rook's back, and Rook's ear twitched, and neither of them moved. What happens to you now? Callan asked. She looked at the drive in her hand. She'd been turning it over without noticing, the way you turned worry stones. The DoD wants me to consult on the oversight review. I'm looking at what that involves. She set the drive down on the floor between them. And I'm staying here. Rook's got 12 to 16 weeks of rehabilitation ahead of him, and I told Holm I'd be here for it. Callan looked at the drive, then at her. You carried that for 4 years. I did. Knowing it might never matter. Knowing it might, she said. That was the difference. He nodded slowly. Then he looked at her with the expression he'd been recalibrating since the morning she'd crouched down in a destroyed lobby and put her hand out flat. I owe you more than an apology, he said. You owe me one apology. You already gave it. She looked at Rook. The rest will work out. He was quiet for a moment, then, the first time I saw him go to you, in the lobby, when nothing had worked, when I couldn't even get close, I didn't understand it. I thought it was a fluke. He knew I wasn't afraid of him, and he knew I was paying attention to his pain instead of his behavior. She paused. Animals generally know the difference. Callan looked at her. So do people, he said. Eventually. She didn't answer that directly, but she didn't look away either. Her phone buzzed. Tate, one more thing you should know. The forensic team finished reviewing the Dunmore Communications batch, the 43 documents with Kane's authorization headers. We found something in the metadata. She looked at the message, typed, what? His response came in 3 seconds. The access credentials used to file the fake retraction this afternoon, the ones attributed to you, they were generated using an administrative key that was issued 4 years ago, during your deployment period. She stared at that. Someone didn't steal your credentials recently. They harvested them 4 years ago when you filed your complaint. They've had your access key since the beginning. The bay was quiet. Rook breathed. Callan was watching her face. What is it? He asked. She read the message again. They'd had her credentials since she filed the first complaint, since the day she'd gone through the proper channels and trusted the proper system and put her name on a document that then disappeared into an administrative archive. They hadn't just closed her complaint. They'd taken what she'd given them in good faith and kept it as a tool. For 4 years. And they'd waited until now, until the worst possible moment, until the investigation was at its most critical point, to use it. She typed back to Tate. Where did the key originate? Which system issued it? His response took longer this time. 40 seconds. When it came, she read it once, then again. Then she looked up at Callan. The administrative key that generated the fake retraction, she said. Her voice was level. It was issued by the personnel management system at the military records office. She paused. The one that processed my reassignment paperwork, 4 years ago. The reassignment Kane ordered. Yes. She looked at her phone. But Tate says the key wasn't issued by Kane's office. It was issued by a different department. She met Callan's eyes. One that Kane didn't control. Callan went still. Meaning someone else had access to your credentials, he said slowly. Someone outside Kane's direct chain. Meaning, she said, that Kane wasn't working alone in the way we thought. The leak inside the investigation. The speed of their response. The fake retraction filed with my credentials 4 years after the fact. She looked at the phone. There's a second person, someone closer to the investigation than Kane, someone who's been managing the information flow from inside. She stood up. I need to call Finch, she said. She was already dialing when the bay door opened, and Nora Finch walked in, not with the purposeful, controlled energy she'd carried for the last 2 days. Slower. And she wasn't alone. There was another agent behind her, one Madison hadn't seen at the field office, and his hand was resting near his jacket in a way that wasn't casual. Finch looked at Madison's phone. Put that down, she said quietly. Please. Madison looked at the agent behind her, at the position of his hand, at the expression on Finch's face, which had rearranged itself into something that was trying very hard to look like authority and was revealing around the edges something that looked a great deal more like fear. She looked at the phone in her hand. Tate's last message was still on the screen. The key was issued through the IG office personnel system. Internal. Someone inside the investigation. She looked at Finch. Finch looked back at her. "I said put the phone down," Finch said again. And this time the agent behind her took one step forward. Madison didn't put the phone down. She held it at her side, screen facing out, Tate's message still visible, and she looked at Nora Finch with the particular stillness she'd learned in rooms where the wrong move cost everything. Not frozen. Calibrating. Callan had come to his feet. Rook lifted his head from the floor. "Nora," the agent behind Finch said, low and sharp, like a reminder. Finch's jaw tightened. "Madison, I need you to listen to me very carefully. There are things happening right now that you don't have the full picture of, and if you make the wrong call in the next 60 seconds... "The administrative key," Madison said. "The one used to file the fake retraction. It came from inside the IG office." She watched Finch's face. "How long have you known?" Finch said nothing. "You called me from an unsecured line this afternoon," Madison said. "You told me the warrant was executing at 3:30. An hour later, Kane's archive deletion was already running." She looked at the agent behind Finch, late 40s, unfamiliar, the specific blankness of someone performing a role he'd been briefed on rather than invested in. "Who is he?" "Internal Affairs," Finch said. DODIG. "He's been running a parallel investigation." A pause that cost her something. "Into me." The bay was very quiet. Madison processed that for 1 second. 2. "You're not here to stop me," she said. "No. You're here because you knew I'd figure it out, and you wanted to be the one in the room when I did." She looked at Finch directly. "How compromised are you?" The word compromised landed between them like something physical. Finch's expression shifted. The controlled professional surface cracking along a line that had been under pressure for longer than this conversation. "I passed information," she said. Her voice was flat and deliberate, each word placed carefully because it was the end of something and she knew it. "About the investigation's timeline, the file count, the warrant schedule." A breath. "I thought it was containable. I thought I could manage what they knew and still bring the case home." "Someone had something on you," Madison said. Finch didn't answer. "That's not a question." Madison kept her voice even. "They had something on you and they used it, the way they used my credentials 4 years ago. They collect leverage. That's the whole operation." She paused. "Did you insert the fake retraction?" "No." Firm. "That was Kane's people. I didn't know they had your credentials. When Tate found the key origin, I knew the trace would lead back to my office, and She stopped. "I came here to tell you myself, before anyone else did." The internal affairs agent said, "Agent Finch." "I know," she said. To him, not to Madison. Then she looked at Madison one more time, and the thing in her face was something close to the look of someone who understood exactly what they'd thrown away and didn't have the luxury of not knowing it. "The case is intact. Everything we built, your files, Kessler's testimony, the Dunmore records, none of that is compromised. I protected the evidence. Whatever else I did, I protected the evidence." "I know you did," Madison said. And she meant it, and it didn't fix anything, and both of them understood that. The internal affairs agent stepped forward. "Agent Finch, I need you to come with me." Finch went. She didn't look back. The bay door closed. Callan was standing with his hand on Rook's back, and he looked at Madison with the expression of someone who'd watched a situation resolve into something that was true and right and deeply not clean, and was figuring out how to hold that. "What happens to the case?" he asked. "It goes forward." She looked at her phone. Finch passed timeline information, not evidence. The evidence is intact. She looked at the door. She was right about that much. He nodded slowly. "And her?" Madison was quiet for a moment. "She made choices that helped people who were hurting animals and covering it up. Whatever pressures she was under, but they were real. But the choices were still hers." She slipped the phone into her pocket. That's the part that doesn't go away. Rook was watching her from the floor. She crouched down and put her hand on his neck, and he leaned into it the way he always did now. Not desperate, not uncertain, just present. Like he'd decided she was worth leaning on, and that was the end of it. "Get some sleep," she told Callan. "Tomorrow starts early." Price called at 7 the next morning. The parallel investigation into Finch had been running for 6 weeks, which explained things Madison had noticed and half filed away without understanding. The slight hesitations, the moments where the timing had been fractionally off. Internal Affairs had been building their own case alongside the main investigation, using Finch's disclosures to track what information was leaving the task force and through which channels. "She's been cooperative since last night," Price said. "She's identified 2 additional contacts inside the Delvane network, people Kane had recruited to monitor the investigation from adjacent positions. We're executing on those this morning." "Is the case against Kane affected?" "No. If anything, Finch's cooperation has strengthened it. She can testify to what information was requested from her and by whom, which closes a gap in the conspiracy timeline we hadn't been able to fill from the Dunmore records alone." Madison sat with that. "She'll be charged," Price said. "Obstruction, disclosure of protected investigative information. The prosecutor's office is working on the specifics." A pause. "She's not walking away from it." "No," Madison said. "She knew that when she came in last night. For what it's worth, and I know it's a complicated thing to say, she did protect the evidence, even when she could have let it get buried." "I know." Madison looked out the window of her apartment at Caswell Street in the early gray morning. "I know she did." The formal charges against Victor Kane were read in federal court in Portland 3 weeks later. 11 counts, the prosecutor's office, and a gallery that included 2 investigative journalists who'd picked up the story when the contractor arrests went public and hadn't put it down since. Madison wasn't in the courtroom. She was in the rehabilitation room at Harlow Peak working Rook through his 3rd week of post-surgical exercise protocol, controlled movement, precise range of motion work, the painstaking incremental process of teaching a body that had been compensating for damage to trust itself again. It was slow and unglamorous and required the kind of sustained attention that didn't photograph well and didn't lend itself to summaries. She preferred it that way. The charges made the news. Kane entered a not guilty plea that his attorney walked back to a negotiated arrangement 6 days later, when the full weight of the evidentiary record apparently made clear that not guilty wasn't a position the available facts would support. The arrangement involved 8 of the 11 counts, and the sentencing terms that the prosecutor's office released publicly were specific enough to make clear that the word arrangement was doing a great deal of work to soften what was, functionally, the collapse of a 40-year career and the prospect of the next several years in a federal facility. The 2 contractors pled separately. Feld, who'd run the private security operation in Nevada, had more exposure than Kane and less leverage, and his attorney's attempt to position him as a peripheral actor rather than a central one lasted exactly as long as it took the prosecution to introduce the financial routing documentation Kessler had preserved. He stopped trying after that. Delvane Processing surrendered its military contracting licenses and was placed under a consent decree that required independent oversight of every record management function it still performed. The company's CEO resigned the same week. 3 other employees were charged in connection with the falsification scheme, 2 of whom cooperated immediately. Kessler received the immunity arrangement he'd asked for in exchange for testimony that the prosecution's office described, in unusually direct language, as essential. He didn't seem relieved by it. He seemed like a man who'd done what needed doing and understood that doing it didn't clean anything up retroactively. Finch was charged with 2 counts. She pled guilty to both. Her attorney argued for leniency based on the cooperation and the fact that the core evidence had been preserved, and the judge acknowledged both before sentencing her to 18 months. She didn't appeal. Madison learned about the sentencing from Price, who called her on a Tuesday afternoon when she was between appointments. 18 months, he said. I heard. Are you? I don't know what I am about it, she said honestly. She helped build the case, and then she helped undermine it, and both of those things happened, and neither one cancels the other out. She paused. I hope she does the 18 months and comes out the other side with something she can live with. That's the most I've got. Price was quiet for a moment. That's more generous than most people would be. It's not generous, she said. It's just accurate. Well, the formal acknowledgement came on a Thursday, not a ceremony. She'd made that clear when Harmon's office had started discussing formats. She didn't want a ceremony. She wanted a document, on the record, in a system that had spent 4 years pretending her complaint had never happened. What arrived was a 7-page formal finding from the DoD Inspector General's office. It stated, in the specific careful language of institutional accountability, that the complaint filed in 2021 by Madison Reyes had been valid, that its administrative closure had been improper and retaliatory, and that the personnel actions taken against her in the following 18 months, the reassignment, the performance notations, the slow erosion of her career path until there was nowhere left to go but out, had constituted a systematic effort to suppress a legitimate report of fraud. 7 pages. Her name on every one of them. She read it twice, alone in her office at Harlow Peak, with the door closed and the overhead light doing what overhead lights did, and she let herself feel the full weight of it. Not the vindication exactly, but the fact of being seen. Of having a record that said she was right. She was always right, and the people who told her otherwise knew it. It wasn't a clean feeling. Vindication never was. You didn't get back the years, or the career, or the version of yourself that might have existed if the system had worked the way it was supposed to. You got a document that said the thing you already knew, and you had to figure out what to do with that. She folded the document and put it in the same drawer where she'd kept the encrypted drive for 2 years. Then she went back to work. The consulting arrangement with the DoD Oversight Office began 6 weeks later, part-time and structured around her schedule at Harlow Peak, which Petra had reorganized to accommodate without making a production of it. The work was exactly what Harmon had described: reviewing evaluation protocols, identifying systemic gaps, writing framework recommendations for oversight processes that were independent enough to catch what the old system had been designed not to see. It was painstaking and bureaucratic and sometimes infuriating, and she was good at it in the specific way she was good at most things. Not because it came easily, but because she paid attention and didn't stop. The 19 surviving dogs in the program were reevaluated over a 6-week period by independent veterinary teams operating under the new emergency protocol. 11 of them had documented injuries that previous evaluations had missed or cleared. All 11 received treatment. 3 required surgery. All 3 made it through. The surviving handlers were notified individually. Some of them had known something was wrong and hadn't had the language or the standing to say so. Some of them had believed the evaluations. All of them, in different ways, had been carrying something that wasn't their fault and had been told it was. Rook's first full run happened on a Saturday morning 11 weeks after surgery. It wasn't impressive by any technical measure. He went maybe 40 yards down the fenced yard behind Harlow Peak at something approaching a trot, and then he stopped and turned around and looked at Callan with an expression that dogs got when they'd done something they weren't entirely sure about and wanted confirmation that it was okay. Callan said, "Yeah, that's good. That's really good." Rook did it again, faster. Madison was standing at the fence with her coffee going cold in her hand, and she watched Callan watch his dog run without pain for the first time in at least 2 years. And she didn't say anything because there wasn't anything to say that would improve on what was already happening. Callan called Rook back eventually, and the dog came to him and leaned against his legs, and Callan put both hands on him and didn't straighten up for a while. When he did, he looked at Madison. "Everyone underestimated you," he said. It wasn't quite an apology and wasn't quite a compliment. It was something more honest than either, the kind of statement that acknowledged a full history rather than just a moment. She thought about the lobby on that Tuesday morning, the bleach stain on her scrub sleeve, the drive in the locked box, 4 years of filing things away in the dark, in the specific stubborn refusal to let the truth disappear just because the people with power wanted it to. She thought about the imaging films and the fracture that had been there for over a year, and the 3 evaluations that had looked right at it and called it nothing. She thought about what it meant to be the person nobody noticed, in the room where the thing that mattered was happening, doing the work that nobody thought to ask her to do. "The evidence did the talking," she said. "I just kept it alive long enough to use it." He looked at her steadily. "That's not a small thing." "No," she said. "It isn't." Rook had wandered back to the fence and was pressing his nose through the gap, interested in something in the grass beyond it. Just a dog. Just a dog on a Saturday morning, running without pain, with somewhere to be and someone who came back for him. Madison finished her cold coffee. There was a full schedule waiting inside, 4 appointments, a post-surgical check on a cat named something she could never pronounce correctly, and a call with Harmon's office at 2 o'clock to review the preliminary findings from the protocol audit. Normal work and consequential work, and the particular satisfaction of being someone who showed up and did both without needing anyone to notice. She had spent 4 years being the person in the room that nobody paid attention to. She understood now, in a way she hadn't entirely at the beginning, that this had never been a weakness. Invisibility had let her keep working. Patience had let her keep the evidence. Stubbornness, the unspectacular, unglamorous insistence on not letting a true thing disappear just because it was inconvenient, had done what courtrooms and formal complaints and proper channels had failed to do. The loudest person in the room had signed the dismissal order. She'd been the quiet one in the corner, updating a file on an encrypted drive, waiting. She went back inside. There was work to do, and she was the right person to do it, and she'd known that all along. That was enough. That had always been enough. A story about what happens when the people who are supposed to protect you don't, and what one person can do when they refuse to let that be the end of the story. The truth doesn't always arrive on schedule, but if you keep it alive long enough, it arrives.